So very good afternoon everyone. I am Dr. Satyabrata, MDDM clinical pharmacologist, and today I am going to discuss on HDAC inhibitors, that is histone deacetylase inhibitors. Coming to introduction, histone deacetylases are a class of enzymes that catalyze the removal of acetyl groups from acetylated lysine amino acids in histones, thereby altering the transcriptional activation of cellular genes. And HDACs, that is histone deacetylases, can also deacetylate other proteins including transcription factors. And overexpression of HDACs, histone deacetylases, found in some cancers can cause hypoacetylation of core nucleosomal histones. And HDACs, that is histone deacetylase inhibition, lead to accumulation of acetyl group on the histone lysine residues, an open chromatin structure, activation of target genes that are selectively repressed in tumors. Cell cycle arrest induced by HDAC inhibitors is caused by several mechanisms. Most common is increased expression of cell cycle genes such as CDKN1A, that is cyclin dependent kinase inhibitor P21. Then coming to HDAC inhibitors. HDAC inhibitors cause cell cycle arrest by various mechanisms. The examples of HDAC inhibitors are Panobinostat, Romidepsin and Vorinostat, etc. Coming to individual drugs, Panobinostat. Mechanism of action, it is a non-selective pan-HDAC inhibitor, histone deacetylase inhibitor. Inhibitory activity leads to apoptosis of malignant cells via multiple pathways. ADME, that is absorption, distribution, metabolism and excretion. Its oral bioavailability is around 21%, metabolized through CYP3A4. Elimination half-life is 37 hours. Coming to indication, it is indicated in case of multiple myeloma. Coming to adverse drug reactions, diarrhea, fatigue, nausea, peripheral edema, decreased appetite, pyrexia, vomiting, hypophosphatemia, hyponatremia, hypokalemia, increased creatinine, thrombocytopenia, lymphopenia, neutropenia, antiarrhythmia, QT prolongation, etc. can occur with the use of Panobinostat. And while using Panobinostat, closed cardiac monitoring required, and we should be cautious while using Panobinostat. Coming to Romidepsin, mechanism of action, function, it functions as a prodrug. Within cells, a zinc binding thiol of the drug is reduced and interacts with a zinc atom in the pocket of HDAC, histone deacetylase, to block its activity. Coming to ADME, absorption, distribution, metabolism and excretion, it can be given through intravenous route, metabolized through CYP3A4, terminal half-life 3 hours. Coming to indication, it can be indicated in case of cutaneous and peripheral T-cell lymphoma. Coming to adverse drug effect, nausea, vomiting, thrombocytopenia, anemia, leukopenia, electrolyte abnormalities, ECG changes, etc. can occur with use of Romidepsin. So we should be cautious while using Romidepsin. Coming to Vorinostat. Vorinostat is a small molecule also known as SAHA, based on its chemical name, that is suberanillohydroxamic acid. Then mechanism of action, it binds to the active site of HDACs, histone deacetylases, and chelates zinc ions in the active site. This results in accumulation of histones and other acetylated proteins, amongst which are transcription factors crucial for differentiation. It inhibits enzymatic activities of HDAC 1, 2, 3, class 1, and HDAC 6, class 2 at nanomolar concentration IC50 less than 100 nanomolar. Coming to ADME, absorption, distribution, metabolism and excretion, slightly improved when taken with meal, Metabolism mostly through glucuronidation and hydrolysis. Elimination THAP is about 2 hours. Coming to indication of Vorinostat, can be used in case of cutaneous T-cell lymphoma. The adverse effects are diarrhea, fatigue, thrombocytopenia, anorexia, dysgeusia, etc. And it is contraindicated in severe hepatic impairment and pregnancy. So we should be cautious while using Vorinostat in case of if there is any adverse effect there. We should monitor the adverse effect while using Vorinostat. So coming to summary, HDAC histone deacetylase inhibitors seem to be a promising group of anti-cancer drug, particularly in combination with other anti-cancer drugs or radiotherapy. Many other HDAC histone deacetylase inhibitors are in clinical trials for the treatment of both hematological and solid malignancies. And these are my references. You can go through these references to know more about HDAC inhibitors, and you can learn from different articles and guidelines about this topic and gain more and more knowledge. That's all for today. Thank you very much. Jai Jagannath.